The man who felt no pain. Imagine falling from a bicycle, hitting the ground hard, breaking your arm, and feeling absolutely nothing. No pain, no warning, no signal from your body telling you to stop. Now imagine touching a hot stove. Your skin burns, but you do not pull your hand away. Not because you are brave, but because you don't feel anything. This sounds like a superpower, superhuman kind of quality, a life without pain. But in reality, it is one of the most dangerous conditions known to science called leprosy. Hello, I'm Dr. Imran Raza, and you are watching Dr. Raza Health 360 MD. Today, we are discussing a rare medical mystery, a real condition where a person cannot feel physical pain. This condition is called congenital insensitivity to pain. And while it may sound like a gift, it can be life threatening. Why do we need pain? Have you ever thought of that? Pain is not the enemy. Pain is protection. Pain tells us something is wrong. It stops us from touching fire, walking on a fractured extremity, ignoring infections. Without pain, the body loses its alarm system. What is congenital insensitivity to pain? Congenital insensitivity to pain, or CIP, is a rare genetic disorder. People born with this condition cannot feel physical pain. They can still feel touch, pressure, temperature, but they cannot feel pain. What causes it? The problem lies in the nervous system. Normally, when we get injured, specialized nerves called nociceptors detect damage. These send pain signals through nerves to spinal cord to brain. But in CIP, this signal pathway is broken, often due to mutations in genes like SCN9A. This gene helps create sodium channels needed for pain transmission. Without proper function, signals never reach the brain. So, what does life look like for these people? At first, parents may think the child is unusually calm because the child does not cry after injuries. But over time, strange patterns appear. The child may bite their tongue repeatedly, walk on injured limbs, ignore burns, continue playing after fractures because there is no pain, there is no warning, there is no alarm system. So, the real dangers which pain prevents is without pain, small injuries become severe. Common problems include repeated bone fractures, untreated wounds, burn injuries, joint damage. And so there is a silent internal damage, even worse. They may not feel internal pain, meaning appendicitis, internal bleeding, severe infections. These may go unnoticed. These conditions usually cause pain, but in CIP patient, they may progress silently. Childhood risks often develop, like self-injury habits, dental damage, finger injuries because they don't understand danger. So, long term complications over time, repeated injuries can lead to joint deformities, chronic infections, mobility problems. Some may lose mobility early. So, is there a cure? Currently, nope, there is no cure. Management focuses on injury prevention, protective gear, frequent medical checkups, monitoring wounds. Education is essential. Patients must learn to visually check injuries. So, what is the lesson here? This condition teaches us something powerful. Pain is not a suffering, pain is survival. Without pain, the body becomes vulnerable. Would you choose a life without pain, or would that be too dangerous for you? Let me know in the comments. I am Dr. Imran Raza, and you are watching Dr. Raza Health 360 MD. Your better health is my mission. Stay connected, stay safe. Goodbye. My name is Dr. Raza. I'm a practicing family physician in USA for the past 18 years. I'm an American board certified physician and diplomate of American Board of Family Medicine.